Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of Inside JACC. And from the CHARM study, we have a very interesting report that analyzes the relationship between heart rate, baseline heart rate, and ultimate events in patients with chronic congestive heart failure. Now, they do this with a focus of the relationship to left ventricular function and to cardiac arrhythmias, specifically diastolic dysfunction and the presence or absence of atrial fibrillation. So that from the CHARM study, they used their primary endpoint as cardiovascular death or hospitalization. And what they observed, consistent with other studies, was a 23% increase in events in the highest tertile of heart rate versus the lowest tertile. This converts to a 7% increase in events for every 10-beat increase in heart rate. Now, interestingly enough, this effect of heart rate applied to both patients with diastolic dysfunction as well as systolic dysfunction, but importantly, did not relate to the presence or absence of beta blocker therapy or the presence or absence of atrial fibrillation. So an important insight into the role of heart rate in patients with diastolic dysfunction, perhaps another reason to importantly control the heart rate in that group of patients. Now, we've talked before about this very interesting enzyme, proprotein convertase subtilisin KEXIN9, or as it's better known, PCSK9. And this is an enzyme which reduces or inhibits the LDL receptor. And so from the TNT study, the treatment to new target study, they wanted to correlate the plasma level of PCSK9 with the level of events, hypothesizing that the higher the PCSK9, the lower the LDL receptor, and therefore the higher the events. And what they observed in TNT was that in the group of patients who were treated with atorvastatin 10 milligrams, that in fact the higher the PCSK9 level, the greater was the event rate. However, this didn't apply in patients who were taking atorvastatin at 80 milligrams. So some confirmatory data that PCSK9 in fact can influence coronary artery disease, and maybe that effect can be overcome with high doses of a statin. And the last trial I'd like to tell you about deals with the interesting question of the relationship between mutations in genes and the presence of coronary artery disease or events. In this particular paper, the authors deal with a mutation in the ANP, atrial natriuretic peptide gene, which has been associated with increased coronary events. And what they find in a large group of patients who are followed is that mutations in the minor allele, specifically the RS065 mutation in the ANP gene, actually results in an increase in major adverse coronary events in this patient population with stable angina. There was also an increase in acute coronary syndrome, but interestingly, not a correlation with underlying coronary artery stenoses. So some more information that genetic mutations may be very important risk factors in coronary disease. For Inside JACC, I'm Tony DeMaria.